What is the difference between a collection of hospitals and a true healthcare system? What transforms a reactive service that treats illness into a proactive force that promotes health? The answer lies not in the stethoscopes or the MRI machines, but in the invisible architecture that holds everything together: health policy and governance. These are the twin pillars of every functional health system. They are the blueprint and the building codes. Policy provides the vision, the what, and the why. It is the clear framework for achieving our national health objectives. Governance is the how. It ensures that this vision is implemented efficiently, transparently, and equitably. In an era of complex challenges, from pandemics and health inequality to limited resources, strong policy and sound governance are not academic concepts. They are the difference between a system that crumbles under pressure and one that stands resilient. So let's break down this architecture. Health policy is the set of decisions, plans, and actions we undertake to achieve specific health goals. It is, by design, goal-oriented, focused on improving outcomes. Evidence-based, guided by data and research. Inclusive, developed in consultation with all stakeholders. And dynamic, constantly adapting to new needs and technologies. We see this in different types of policy, from public health policy that focuses on prevention, to financing policy that determines how we pay for care, to human resources policy that ensures we have the skilled, motivated health workers to deliver it. But a brilliant blueprint is useless without a competent builder. This is where health governance comes in. Governance is the engine of execution. It is the processes and structures we use to direct and control the system, built on non-negotiable principles. Accountability, clear roles and responsibilities. Transparency, open decision-making. Equity, the fair distribution of resources. And participation, ensuring all voices are heard. This structure operates at every level, from the global agendas set by the WHO to the national strategies of ministries of health, down to the local implementation in our communities. The process of developing effective policy is itself a system. It begins with a clear situation analysis and problem identification, moves to evidence-based formulation, and is strengthened by inclusive consultation. But the most critical phase is often the last: implementation, monitoring, and evaluation. This is where governance ensures the plan doesn't just sit on a shelf. Now we must be honest about the challenges. Our architecture is often flawed. We face political instability that disrupts long-term planning, corruption and mismanagement that erode public trust, fragmented systems and inadequate data. And perhaps the most common failure, the implementation gap, where well-designed policies are poorly executed. So, how do we strengthen these pillars? How do we build back better? We must enhance institutional capacity, training our leaders in evidence-based management. Promote transparency with open access data and public reporting. Foster multi-sectoral collaboration, because health is not made in hospitals but in homes, schools and workplaces. Down, adopt technology to improve monitoring and accountability. And most importantly, strengthen community engagement, ensuring that the people we serve have a voice in the systems that are meant to protect them. At the heart of all this is leadership. Effective health leaders set a clear vision, build consensus, uphold ethical standards, and champion innovation. They are the master architects who ensure the blueprint becomes a building that serves everyone. The benefits of getting this right are profound. Strong policy and governance. Enhance system efficiency and coordination. Promote equity and access. Strengthen public trust. And build resilience to face future crises. In conclusion, health policy and governance are not dry topics for bureaucrats. They are the lifeblood of a just and effective health system. They are the commitment we make to our citizens that health is a right, not a privilege. When we strengthen these pillars, we do more than improve efficiency. We build systems that are not only more effective, but also more just, resilient, and truly responsive to the needs of every individual. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.